And joining us now to talk more about this is Dr. Chris Pernell, public health physician and regent at large for the American College of Preventive Medicine. Doctor, thank you so much for being here.
Thank you for having me, Kelly.
It's wonderful to have you as always. So do you think canceling classes, sanitizing, requiring masks, which has been controversial for some parents, are necessary when you have outbreaks?
Kelly, the way that I want the public to think about it is that we always carry with us our prevention toolkit. And depending on what activities we're seeing in real time, activities on the ground is what tool we pull out of that toolkit. So we know that vaccines are our most powerful tools, right? We want people to make sure that they're vaccinated, and when the updated booster becomes available, that people get boosted. The last time we had a booster available, only about 17% of the eligible population went ahead and got vaccinated. In addition to that, masks are useful tools if there is an uptick in respiratory viruses. So that's how you should think about it. And then don't forget about hand washing and social distancing. And if you are sick, do not go out into the public.
Is there anything else these schools can do to prevent an outbreak situation?
It's hard to say do X and you never will see any type of viral activity, right? Because viruses spread when people go indoors. We know that there's RSV, we know that there's flu, there are the common colds, we know that there's COVID. Masking is a way to help prevent that, and physical distancing as well as filtration systems. That is something that I think more schools and just more public buildings should think about. How are we filtering and purifying the air that people are breathing? Because some of these viruses are spread by airborne transmission and others by respiratory droplets.
Well, we'd love to get your take on another story that we've been following closely as well. We are learning now what caused Marni James' cardiac arrest. Now, it stemmed from a congenital heart defect. That's according to a statement released by his family. The son of NBA legend LeBron James is expected to fully recover. That is the good news following his treatment. So let's dive a little bit deeper into cardiac arrest in young athletes caused by congenital heart defects. He's 18 years old. So why did this happen to him now and not earlier in his life, doctor?
Unfortunately, this is the time that these symptoms may evidence themselves because you have young athletes going through strenuous activities. And when they're going through those strenuous activities, had they developed a congenital heart defect early during the pregnancy, usually within the first 8 weeks of pregnancy, that's when it's evidence, because that's when the heart is taxed. For the public to make most use of, know that if you have a child engaging in sports, please get a physical before that child undergoes any, physical activity or organized sports activities. Thankfully, in Marni James's case, without knowing which specific congenital heart defect that he has, it is something that is treatable.
Wonderful. And once someone this age experiences something like this, can they go back to living and operating the way they were? Do you think he'll be able to return to basketball?
That depends, Kelly. So what we're hearing from the physicians who were taking care of Marni is that this is a treatable and manageable congenital heart disorder, and that he will be able to return to his normal activities of daily living as well as playing organized sports. And that means that the physicians in charge of his care know the specific congenital heart defect. They know how to treat it. Sometimes you can treat it with cardiac interventions, whether that's some type of angioplasty or surgery. So that's good news. Whether or not that's going to be true for everybody really is going to depend on the specific anomaly that we're talking about.
Got it. Thank you so much. So I wanted to get your take on one other health headline we've been following. Wegovy could help people with the most common form of heart failure. Researchers say they saw an improvement in the symptoms of people who had preserved ejection fraction, which is when the heart can pump normally but is too stiff to fill properly. That's according to a study published Friday in the New England Journal of Medicine. So scientists say Wegovy helped the patients who had shortness of breath, fatigue, trouble exerting themselves, and swelling. What do you make of this latest study?
This is very good news. And this information comes on the heels of previous information that was made available that Wegovy can reduce the likelihood of stroke or heart attack by 20%. So knowing that it has that possible protective benefit around cardiovascular issues, in addition to helping persons who have overweight and obesity lose weight, just means that this drug is more powerful and more useful.
Thank you for watching. Go to NewsNationNow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.